Okay, good morning, members of the Senate Health Committee and House Pandemic Preparedness Committee. Good morning. Today is Friday, December 11th. We are here for our 10 a.m. joint briefing on the State Department of Health's vaccination plan. I'm joined with the co-chair for today's proceeding, Representative Linda Ichiyama, who I'm very appreciative and was very gracious in helping us organize and join in this briefing jointly. Members, a couple of notes for housekeeping purposes. This meeting, including the audio and video of the remote participants, is being streamed live on YouTube. Members of the public who are watching, you will find links to the live stream options on the broadcast page of the legislature's website. Real quickly, I'd like to introduce the members of the Senate Health Committee. We're joined this morning by the Vice Chair from Maui, Senator Rosalind Baker, Senator Sharon Moriwaki, and I think also joining us is Senator Kurt Favela, who I don't think is on at the moment. Representative Ichiyama, would you like to introduce your members?
Thank you, Chair, and thank you very much for graciously co-hosting this info briefing with us. So for myself as Chair of the new Pandemic Committee, we also joined by Vice Chair Rep. Stacey Lynn Eli, Representative John Mizuno, Representative Tina Wildberger, Representative Kyle Yamashita, Representative Ty Cullen.
Okay, great. So let's get started. And for the opening remarks, I'd like to pass it back to you, Representative Ichiyama.
Thank you. I just wanted to say first and foremost, thank you so much to the members and to the presenters, especially for making the time to be with us today. We know how busy all of you are on the front lines. Many of you are doctors serving our hospitals and medical facilities every day, so we really appreciate it. I wanted to also make sure that everybody knows that we have a hard stop at 11:30. We have a lot of presenters to get through, so we're gonna let them go first, and then we'll be taking questions at the end. If there are questions that we cannot go to, we'll be sure to share them with Department of Health for future follow-up. And then finally, I just wanted to note that I believe this will be the first in a series on the vaccination plan for the state of Hawaii. We have many stages to go. We have many months to come. This is going to be a long journey for all of us as a community, and we want to make sure that everybody stays informed. So please know that this will be the first in a series. And with that, I'd like to turn it over to our freshman representative, Lisa Martin from House District 51, to share her personal experience with the COVID-19 vaccine.
Thank you. Aloha, my name is Lisa Martin, and I have a doctorate in public health. I used to work for a clinical research program at our medical school, and I never thought I would be in a clinical trial myself, but I did participate in the Pfizer COVID vaccine trial. I'm very health conscious personally. I'm a vegetarian, I exercise, and I would never take a supplement that hasn't been tested. So I did my homework about the risks of the vaccine, and I felt the risks were low. In fact, here in Hawaii, many of the participants in the trial were doctors and dentists, people who have a good understanding of the biology. But why did I take the risk at all? I would be lying if I said I was really afraid of COVID for myself. I know that I should be, but nobody around me has been very sick or died. It seems far away. What really inspired me are the problems that I do see all around our state. My friends' small businesses failing, people losing jobs and with it their self-esteem, children falling behind in school, people isolated or worse, trapped at home with abusers. I did it because I want to be free of the measures that we've had to take to keep our rates low here. I want my life back. I want my elderly parents to be able to resume their activities, and I want my children to go back to school. I did have some side effects the day after each shot. The first one was just a sore arm and a headache that went away with ibuprofen. The second one was worse. I had a headache and I felt nauseous for a day. Was it worth it? Absolutely. It's amazing that we have this vaccine so quickly. And that is not because they cut corners on safety. It was fast because the governments took a financial gamble that they have never taken before. They invested in large-scale production of a vaccine that they might have had to throw away. They also provided a secure market so that unprecedented money and talent was poured into research. And researchers shared data and knowledge across the globe in a way that has never been done before. The vaccine is not mandatory, but if enough people take it, We can reopen our economy and hug our kupuna again. Thank you.
That was really great. Thank you very much for sharing your story and your participation. That was awesome. So let's move into the presentations. First, to present on some basics and some basic medical information on the vaccine itself, I'd like to welcome Dr. Tarkan Collis, the Chief of Infectious Disease at Kaiser Permanente, Hawaii. Dr. Collis, good morning and thank you for being with us.
Good morning. Can you guys hear me okay? Very good. Chairman Ichiyama, Chairman Ke'ohokalole, thanks a lot for having me here today. I appreciate the opportunity to talk to you all. Before I get started, and by the way, I'm going to go kind of quick because there's a lot of ground I want to cover. I wanted to be clear that I'm speaking today in the context of a clinician. I wear a lot of different hats at Kaiser, but certainly the one that's most important to me is really being part of an excellent infectious disease team. Our team diagnosed the first 2 cases of COVID-19 in the state back in early March. And I remember both of them very clearly. The first was a lovely elderly lady who did great with a lot of careful outpatient support, and we're still in touch, which is wonderful. She's a really fun lady. The second case was an extremely bright and an elderly man who was one of the sickest patients I've seen with COVID really since then. We just happened to get a really floridly septic patient right off the bat. We lost him after about a month of intensive support in our ICU. I've seen my share of deaths from COVID since then, but that one really sticks with me for some reason. Maybe because it was really my first COVID death. There's not actually a week that goes by that I don't think of that case in some context. Oftentimes, it's really just finding myself wondering and wishing that I knew then what I know now about how to treat this infection, because I think we might have been able to save him. More recently, though, it's been wishing that we could have prevented him from getting sick in the first place, which is, of course, why we're here today. In the 9 months since March, we've really been in hand-to-hand combat with this virus. Some months have been better than others. August and September were particularly brutal. And those are really the table stakes that I put in front of us today as we discuss vaccination as a means to try and put an end to a lot of the suffering that we've been witness to. So we'll get right into it. My goal for today is to really try and demystify these mRNA vaccines a bit and to frame the issues ahead. So next slide, please. I think it's important to be clear about the work ahead and the magnitude of that work in front of us. The total tests performed in the state so far for COVID have been around 710,000 over about 10 months. Think of the effort and the organization involved there. But the total Hawaii population is around 1.4 million, as you guys know well. And the majority of those will be vaccine candidates and will likely require 2 shots each. So we're talking about 4 times X relative to the number of tests done to this point. There's a lot of baseline skepticism regarding vaccines and COVID in a segment of the population, and it's really going to be critical to address these directly through thoughtful and honest education. So next slide, please. Let's just take a step back for a second and talk a little bit about vaccines in a general sense, sort of a vaccine 101. Really, the aim of any vaccine is to safely present specific proteins that mimic parts of a virus or a bacteria to your immune system in order to create an immune response that protects you. Next slide. There's a lot of ways to do this, and mRNA is really simply the newest approach. It may also prove to be among the cleanest and most effective, I suspect. Next slide, please. At the risk of inducing PTSD in some of you and bringing you back to high school or college biology class, let's go over a little bit what is mRNA in the first place. mRNA, quite simply, is part of a natural messenger system within our cells. I think of it as a recipe card of sorts that tells our cells how to make specific proteins. It's short-lived by nature. It's degraded promptly by our own cells. Next slide, please. mRNA, it's important to realize what it is not. mRNA is not DNA, and mRNA vaccines do not interact with our genes. That's crucially important to understand. There's been interest in harnessing mRNA for vaccines for about 30 years or so, first back to the University of Wisconsin and then subsequently at the University of Pennsylvania. But the major breakthroughs in delivery of mRNA to cells, as well as efficacy and safety, have all come in the last 10 years. And COVID-19 really came along just as mRNA vaccine technology was peaking and ready for prime time, which is one of several really lucky breaks. Next slide, please. Let's talk about the Pfizer and Moderna vaccines a little bit and just kind of go under the hood here. Pfizer and Moderna vaccines really use tiny strands of synthetic mRNA to direct some of our cells to make a protein that looks like the part of the SARS-2 virus that binds to our human cells. The virus's spike protein, the part that points out and looks kind of spiky in the pictures you see. When our cells make this new protein, our immune system reacts to that protein, producing antibodies and B cells and T cells against it and protecting us from COVID-19 itself. Next slide, please. To deliver this mRNA to our cells safely, little bits of lipid fat essentially are used to coat this mRNA, which is a really remarkable technology that took a lot of effort to develop. Next slide. Both of these vaccines require 2 shots, either 3 weeks apart, which is the Pfizer, or 4 weeks apart, which is Moderna. And both vaccines need deep freezing rather than refrigeration for long-term storage. Next slide, please. There are some real advantages to the mRNA platform. Among the most important is that there's no need for live virus in this delivery system, which is nice. A lot of the vaccines that are coming down the pike, AstraZeneca's and Johnson & Johnson, do require live virus, which is not particularly problematic and has proved safe so far. But this one, really this class does not involve any live virus at all. Our DNA is also untouched by the vaccine, as I've noted. mRNA is really a cytoplasmic rather than a nuclear issue here. And both mRNA and its lipid coat naturally and potently really boost our own immune system's response to the vaccine itself, which is a really elegant design. Next slide, please. Dr. Ashton, I think, is going to go over the case for the 2 vaccine trials in some detail, but I'm just going to go over the top line results, which are important. And I would say that both of these vaccines were tested in large, randomized, double-blind, placebo-controlled, and multi-centered trials, which is really the gold standard of clinical trial design. Both trials were large. The Moderna's 44,000, I'm sorry, the Pfizer's 44,000, the Moderna's 30,000. And the efficacy was quite remarkable. Between these 2 vaccines, we're seeing 94 to 95% prevention of COVID-19. Just for reference, in a good year, flu vaccine might be 40 to 60% effective in preventing infection. So this is quite a remarkable result. We're also seeing near complete protection against severe infection. So for those few folks who do manage to get COVID-19 after vaccination, the infection appears very mild. Efficacy appears excellent both in older adults and across racial and ethnic groups. And this is a crucial point. You know, when you see a vaccine that you don't need to give additional doses to or a higher dose in the elderly, that's a marker of real potency and effectiveness, and we're seeing that here. And this is really far, far better than anyone had hoped. These results are really kind of a moonshot in the vaccinology world, and we're thrilled to see them. Next slide, please. In terms of safety, I think it's important to realize that neither of these studies was stopped out of concerns for severe adverse events. As you know, there were several trials paused, as happens commonly in vaccine trials, just to make sure that they were safe to go forward. Neither of these trials was among them. The detailed safety review by the FDA showed no significant safety concerns of the Pfizer vaccine. Moderna's review is underway now. I would also note that really looking back, neither animal models nor preclinical studies of these vaccines turned up worrisome safety signals. And I should also point out that other mRNA vaccines in development show excellent safety so far. These are being looked at for a wide variety of infections, including flu and rabies, as well as certain cancers. Next slide, please. Side effects. Now, this is a crucial point. It's going to be really important to educate folks about this, about side effects, so that they know what to expect, because they're likely to be significant, especially after the second dose. And this is just a critical point of education. People should really expect to feel achy and tired and have a bit of a sore arm for a day or two, especially after the second shot. And as I tell my patients, you know, this is the feeling of your immune system at work. Okay, it's not a bad thing. It's okay. This will not last long. And of course, it's much better than catching COVID. Next slide, please. Let me just run through before wrapping up some common COVID questions that I get and answer those as best I can. One of them is, will I need to choose between the Pfizer and Moderna vaccines, assuming they're both approved? The answer really there is these 2 vaccines appear largely identical in terms of efficacy from what we see so far, and choosing between them really won't be necessary. Vaccine choice, I think, may become an issue down the road once we have multiple different classes of COVID vaccines available. But it shouldn't be an issue with these two. I tell people these are really two different color M&Ms from my standpoint. Next slide, please. What don't we know about these vaccines yet? I think that's important to be upfront about. We don't yet, of course, have safety and efficacy data at the 6-month mark. We don't yet know if boosters may be needed down the road. How well do these vaccines prevent asymptomatic infection or COVID transmission? That we don't know yet, but we will get answers to that before long. Important there that the messaging be to keep masking and keep physical distancing even after vaccination until that is clear. We will learn about vaccine efficacy and safety in specific subpopulations at some point soon. Pregnancy, immunocompromised patients, and children are all forthcoming data. Next slide, please. And then this is a question I get all the time. Actually, I was working late in my office the other night, and one of the nice custodians asked me this. Dr. Collins, will you choose to take an mRNA vaccine? And that's a very easy answer for me. It's a definitive yes. Certainly, I think once you understand, once we know, what we know already about these vaccines, really an A+ scorecard in terms of efficacy and safety in the short term, and strong signals of longer term efficacy, then it's a simple question, right? Then it's just a question of weighing what we don't yet know about these vaccines, basically 6-month or 12-month data, versus what we do know about the risks of catching COVID-19, which is a really profoundly dangerous infection in my mind. So for me, that's a very easy call. So next slide, please. So I close with this image for a specific reason, which is that we've been granted an incredible gift with this vaccine. Speaking as an infectious disease doc, we are very, very lucky that this virus has a soft target for vaccines, which is the spike protein. This is the soft underbelly of this virus, and we figured that out and designed vaccines to attack that spike protein in under a year. And that's both a miracle of science, and it's also a stroke of incredible luck that we have to take advantage of. SARS-CoV-2 has a chink in its armor, and we have a way to attack it now, and that's really a gift that we've been gifted. I would urge us all to remember there's only 2 ways to achieve herd immunity once you've got a pandemic on your hands, and that's either through immunization or through natural infection. If you take a look at what's happening on the mainland right now, you'll see what natural infection looks like with this virus once you're in exponential growth phase. ICUs are being overrun in lots of states, and it will get worse, trust me. Right now on the mainland, more people are dying every day from COVID as died in 9/11, over 3,000 a day, every day, remarkable.
No.
So please understand.
Not COVID by itself.
Yeah, he doesn't say how many died from flu.
Yeah.
Our chance as a state to escape what is happening on the mainland right now, and trust me, that can absolutely happen here. You can look at these vaccines from an economic point of view as a means to get our economy back on track and get folks back to work, and that's super important. But I look at this in a very personal sense. This is a chance to prevent some of the tragedies I've seen in our hospital over the last 9 months, and it represents a chance for me to hug and hang out with my parents in Kailua again, and to get them both to a safe place. So this is very personal for me, and it should feel very personal for you guys as well. So I will stop there. I hope that was helpful in setting the context for this briefing. When I'm tired, and I'm tired a lot nowadays, as I'm sure many of you are, I try and remember that when they write the history of this pandemic years from now, our kids and our grandkids are going to ask us a lot of questions. Right? They're going to ask, what was it like? Was that scary? Did you run out of things to watch on Netflix or whatever? But they're also going to ask, what did you do to help? Right? And I want to be really proud of that answer. I think we all should want that. So there's a lot of important work ahead, a lot of educating to do. So let's all please work hard together, and let's go get this thing right. So thanks again for having me, and apologize for running a little long. Aloha, you guys.
Thank you very much, Dr. Collis, for that very informative presentation. Members, I'd like to remind you to please keep your microphones muted throughout the presentations. There will be time for question and answer at the end. If you'd like to ask a question, please put it in the chat box. If you interrupt, because of the time schedule, we have so much information to go through. If members are going to interrupt, you will be asked to mute, or we will mute you. So I'd like to move on to the next section, which is the COVID vaccine approval process. We're happy to have Dr. Melinda Ashton, who is the Chief Quality Officer at Hawaii Pacific Health, which includes Kapi'olani, Palimomi, Straub, and Wilcox hospitals. Thank you very much, Dr. Ashton, for joining us.
Thank you very much for inviting me. I don't see my video, but I hope you can hear me. I wanted to introduce myself. I'm Dr. Melinda Ashton. I'm a pediatrician. I've had a pediatric practice in Honolulu for 35 years, and I am also the Chief Quality Officer at Hawaii Pacific Health. And what that means is that I've been leading the clinical response for our hospitals and clinics for COVID-19. So next slide. I was asked to talk about the vaccine testing process and what it is that allows us to feel safe about this vaccine. I think we're all very much aware, as Dr. Collis has already told us, that it's truly a miracle that we've got a vaccine within a year of actually identifying this virus. And I think that miracle is great, but many people are skeptical and wonder, why is it that we were able to get this done so quickly, and is it in fact safe? So what you see on this slide is the standard vaccine testing process. And in fact, this is a process that is used for approving medications and other things that the FDA regulates. And this has been in place for decades. This is not new. So we always start with preclinical testing, which means we don't test in people until we're sure that it's safe in animals. We then move on to phase 1 safety trials with a very small number of people, trying to understand what is the correct dose to be safe and to in fact make sure that it works. And then we move on to phase 2, which is—
So you want me to call you, give you a half-hour lead time or something?
Yeah. And once we have those tests done, then we can increase the number to the thousands of people that you've heard have been involved in the Pfizer and Moderna studies at this point. Once that information comes out, there's early or limited approval, which is what we, kind of the phase we're in, and then we're waiting for that initial emergency use authorization, which should be coming out in the next day or two for Pfizer. Along each step of the way, the Food and Drug Administration has specific things that must be reported, evaluated, and approved before going on to the next step. And so this is what's been in place for many, many years. The thing that is different, and there are some things different with the COVID vaccine approval, which I'll show you on the next slide, but one thing you need to know is there was a lot of preclinical work going on to make sure to have ready this mRNA vaccine that we now have available to us. So this didn't all start in January or February of 2020. Much of this work has been going on for decades with dedicated scientists who knew that a pandemic would be coming at some point and that we would need some vaccine response. And as Dr. Collis said, this vaccine platform, this mRNA vaccine platform, was ready for this pandemic. So the next slide. This slide is to demonstrate to you what the difference has been with the COVID-19 vaccine development process. Now, I should mention briefly that the Pfizer vaccine is not actually part of Warp Speed. The Pfizer company went ahead and did the vaccine development without the same support from the federal government that the Moderna folks got. But both vaccines have kind of ended up in the same place on the same timeline. So it shows you that it could have been done with or without Warp Speed, which is the federal program. So here on this slide, what you see in the first couple of boxes, that 3 months and 5 months on the top row, is the typical process for phase 1, phase 2, as I've just been through. And then you look at 21 months for phase 3 and 23 months for phase 4, adding up to years to get to completion of vaccine. What has happened with the COVID-19 vaccines, all of them actually, is that these phases have been combined. So there have been phase 1 and phase 2 done together. So we look at safety and dosage in a group, and we look at a larger number thinking about the same thing. So it's all been a compressed timeline, but none of the steps have been skipped. One of the really important things that happened, and Dr. Collis mentioned this briefly as well, is that the manufacturing of the vaccine, so actually creating enough doses in the manufacturing plants so that we have them ready to deliver, was moved up to the beginning. So there was a bet placed that these vaccines would be the right ones to give out to people. Now that takes a lot of money to be able to support that development of vaccine we might end up throwing away. And so we're very fortunate that we're not going to throw it away, but it's also ready to ship and is actually being shipped around the country in anticipation of approval. So that's one of the major differences. So it's not that any of the study steps were skipped. It really is the manufacturing process was accelerated as well. The next slide, please. So I wanted to show you this chart, and I know people don't necessarily like charts and graphs, but I think this one's really important. This came from Pfizer in the safety information that they put out in the last few days. And really, does it work? And so what this chart tells us is the red line shows the people who received the placebo or the fake shot. They actually got a shot in their arm of something that wasn't the vaccine. And among that group of people, 162 of them became clearly infected with COVID-19. In the group equal number of people who received the vaccine, only 8 of them got COVID-19. None of them got severely ill. And so what this does is, first of all, it tells us that it's really useful to have the infection raging in the communities where people are testing these vaccines, because you get exposed and you can learn very quickly whether the vaccine works or doesn't, which is one more way that this has been sped up, right? Across the country, not so much in Hawaii, thankfully, but across the country, there's enough COVID vaccine for people to be exposed and become ill. And if the shot doesn't work, you would see that. If the shot does work, which is what this shows, you don't see those infections. Next slide, please. So as I said, the FDA approvals occur at each step. The safety and other data are submitted prior to consideration for approval of the next step. We are waiting, the next sort of step we're waiting on is the Advisory Committee on Immunization Practices, which will be reviewing the information over the weekend. They make recommendations on who should receive the shots. We've already had the Advisory Committee to actually recommend to the FDA that they approve this Pfizer vaccine, and we expect the same process to occur late next week for Moderna. So what we're looking for, what we're waiting on any minute or any day now is an emergency use authorization from the federal FDA to say that we are allowed to start giving shots. That's coming very quickly. We're really grateful that these shots are coming. The healthcare workforce is going to be up first. And I think, as you heard Dr. Collis say, there are many of us who are saying, yes, please, I'll take that shot. I don't expect there to be a lot of people saying, no, thank you. Then what we'll see is prioritization categories of people in tiers after that who will receive the vaccine. And what I'm really looking forward to is getting enough people in Hawaii willing to take this vaccine when it's their turn, so that by high school graduation, we actually have graduation, and that baby luau's can happen again, and that we can go to the beach and congregate in large groups, that we can safely have funerals, frankly. I mean, even that's not allowed right now. And so those are the things that if we can get everyone convinced that this vaccine is safe, we know it's effective, and we can get them to take the doses of vaccine, those are the kinds of things that we will get back to, not to mention back to school and back to work. Thank you.
Thank you very much, Dr. Ashton. I love charts. That one was particularly interesting and helpful. So thank you again for your presentation. Next, we have, I'm happy to have our new director of the Department of Health, Dr. Bichar, to open up on the Department of Health's vaccination plan. Dr. Char, thank you so much for being with us.
Good morning, Chair Ke'oho Kalole and Chair Ichiyama. Thank you very much for having us on this joint briefing. I would like to reassure you that vaccination is the #1 priority for the Department of Health, and that we have been preparing for months. In order to make this successful, it really is a collaboration with our healthcare partners, our federal partners, counties, state agencies, really the entire community, because we need the buy-in and we need the assistance of all of those entities in order to make this a successful endeavor, and we will succeed at this. Our role at the Department of Health is to protect the health of the community, and we see this vaccination as being really key to that. So our role is to look at the science of the vaccine and then to make recommendations for our community and for our state. For this briefing, we'll focus on phase 1A of the vaccination. And I'd like to introduce Dr. Sarah Kemble, the state epidemiologist, to just really briefly walk us through what's been going on in the process thus far.
Thank you, Dr. Char. So I am Sarah Campbell. I'm the acting state epidemiologist for the Department of Health and the chief of the Disease Outbreak Control Division. The immunizations branch, which falls within our division, provides the technical expertise on vaccine delivery and how to follow and measure its impact. As such, we're coordinating among many partners to accomplish the goal of successful vaccination campaign. Could I have the next slide, please? So at this time, we have been coordinating among over 90 partners and stakeholders statewide, with over 150 individuals represented in the working groups that are involved in preparing for the COVID-19 vaccine. We are anticipating an estimated 81,000 doses in the month of December, which should be enough to cover 35,000 of our frontline healthcare workers and estimated 35,000 long-term care facility residents and staff. Prepared to receive the vaccine and get shots into arms. And we're going to be doing this with the help of our hospitals and all of our medical center partners and many other partners in the community. I'd like to pass off now to the working groups who will discuss what they've been working on.
Dr. Buen Consejo Lam.
Okay, thank you. Hi, hopefully you can turn on my video at some point, but I'm Dr. Buen Consejo Lam. Okay, thanks. So I'm Dr. Buen Consejo Lam. I'm from the University of Hawaii, John A. Burns School of Medicine. And if you could go to the next slide, please. I am the Associate Dean for Academic Affairs here at the medical school. And I've also been part of the Hawaii Emergency Management Association, ESF8, since it was stood up in April, and have been involved in a variety of ways with the state's response. And I sit on a number of these working groups. And so at this time, I'm just going to share very briefly what the prioritization and allocation working group has been doing. This slide really just shows the incredible number of partners that have been involved in these discussions. In the previous slide by Dr. Campbell, you saw the, over 150 people and 90 organizations and whatnot. And so this is just a condensed list just on this working group. The working group meetings, happen to have between 20 and 40 people on it. And the next slide, please. Just really shows the focus of what the working group has been doing. So, this vaccine, as you've heard, it's really quite amazing. It's really quite safe, and the distribution is really a huge challenge. And so we're quite lucky that we will be getting as many doses as we are in the first phase. But we have, even though we have a small population relative to other places like California, we still do know, and therefore all of us are kind of internally looking at lists and setting up all types of processes so that we can make sure that if we have to do more like sub-prioritization, that we can do that quickly. We don't want any of the vaccine to go to waste. We want to get the vaccine to those who are willing to take it and really get it to the priority populations. And so what the figures on this slide show that the prioritization has really been suggested really by the Centers for Disease Control. They have an advisory committee on immunization practices, or ACIP, and they are an independent committee and advise the CDC on all vaccinations and immunizations. And so for me as a family physician, I don't do anything unless the CDC approves it, right? And so this vaccine is no different. And they had a meeting, they've been meeting on this for months, but at their recent meeting on December 1st, they actually looked at a variety of things. They looked at the science. They looked at the challenges with implementation of the different vaccine candidates, what kind of ultra cold freezer requirements might be, shipping requirements, a lot of logistics, other things. And then really looking at the ethics of how to get this very, staged rollout of the vaccines. And so at the moment, all of us around the state are really focusing on the first phase, which, as by now everyone I hope is aware that it's really our healthcare personnel. So stage 1A, which is the light blue bar at the bottom, it's really focused on the healthcare personnel and residents and staff of long-term care facilities. But Hawaii's situation, as you'll hear more, is a little bit different in terms of long-term care facilities and what we include with that. And so one of our other speakers will, because we really do want to make sure our kupuna are protected. And the healthcare personnel are not just the physicians and nurses and respiratory therapists, but it's really all of our partners who might come in contact or have to, change linens or sheets and help with very, very important work of keeping our health facilities safe and clean. And so those are included in phase 1A. But you see that our essential workers, of course, our first responders and others in our education sector, and then our adults with several high-risk medical conditions also are included in phase 1. And so what the work group does is, again, try to make sure we have as accurate data as possible from all of the different sectors. There's a number of different surveys and data gathering that's going on across all of the facilities and with our independent providers, not just physicians, but also dentists and optometrists and others, because we want to get an idea of how many, where they're located, and how many are willing to take it, and including the numbers of people in their offices, because those folks are also included in this stage 1. So there's a lot of work ahead of us, but I'm very happy to share that, again, this really is a big partnership, and we're just happy to be serving and helping the state get this vaccine rolled out. Thank you.
Great. Thank you very much, Dr. Bwankenseholam. Up next to speak on behalf of the Communications Working Group, Alan Tang, who's the CEO of Olumana Loomis.
Good morning. Thank you, chairs and members, for the opportunity to share a little bit of the challenges and the progress of the communications behind the COVID-19 vaccine campaign. Aloha, my name is Alan Tang. I'm a contractor brought in for the Communications Working Group. In a few short weeks working on this initiative, I have observed how the Department of Health, along with other state agencies and the counties, are all doing double duty, their regular day-to-day jobs, while tackling this huge responsibility of stewarding what may be the most significant opportunity to manage this horrible, aggressive virus that has devastated our public health, economy, and our island way of life. Next slide, please. The biggest challenge we face is the speed and scale of the campaign. The impact of the pandemic has been commonly described as unprecedented. And what it simply means is that we have no playbook we can follow precisely to deal with this disruption. In fact, the reality is that we are writing the playbook, drawing from similar experiences in the past, but they were not something that moves this quickly or on such a scale that Hawaii has seen. The environment is extremely dynamic, requiring everybody to be extraordinarily flexible and have the agility to adjust to changing circumstances. Much of the guidance comes from the federal government, but it's not like a complete manual, like the ones you get when you buy a new car. Instead, this comes with packets of information that builds on the previous packet of information. We are also very cognizant of the public health impact of the disease. While we're not as bad as on the mainland and various countries around the globe, Hawaii is closing in on 19,000 cases. And as of yesterday, 274 deaths. That's 274 families who will miss a loved one and miss being loved by that person. But perhaps in Hawaii, and unlike other states, more of us have been affected financially by the pandemic and the loss of island lifestyle, the ability to greet friends with hugs and hang out socially. But we are not alone in this fight. We are working together with the FEMA Region 9 states, where we regularly compare notes as we write this new playbook together. Region 9 includes Hawaii, Arizona, California, Nevada, and also American Samoa, the Marianas, the Marshall Islands, and Micronesia. And we find that everybody is essentially in the same place of progress. They are a larger part of the local communications work group here, which includes over 100 members from state agencies, counties, and sectors representing businesses and employees. They are our eyes and ears to the community and our ambassadors for outreach. One of the key components of our outreach is our medical and healthcare community. Just this week, we completed what I believe is an unprecedented, which in a good way, 2 virtual gatherings of our healthcare community. We hosted an informal virtual session on Tuesday with medical associations, organizations, and health plan insurers with over 500 participants. Last night, we hosted a town hall for all healthcare providers. Over 1,600 participants registered to hear from a panel of experts, much like today, from the science of the vaccine to how we are managing the logistics of distribution and the dispensing of the vaccine in the coming weeks and months. I'm going to actually take this opportunity to extend a request for your partnership to help us engage the constituents in your district with vaccine education. You are a front line to the community, and you have a natural relationship with those whom you serve in your community, and we would welcome your partnership. And obviously, we have been engaging the media with all of our communications. For almost all of this year, the news media has been focusing on everything related to COVID. We will be continuing to engage all forms of outreach, from social media to paid media to community outreach. Next slide, please. Our campaign starts with the building of a foundation of understanding. We have conducted over 30 separate virtual focus groups to assess the healthcare community's levels of acceptance or resistance to the vaccine. And as you know, the healthcare workers are in our first priority group. We learn about the perception of a new product that was developed quickly. We learn how people weigh the benefits of a vaccine when approved under an emergency use authorization instead of a full approval, which won't come until later next year. And understanding how side effects may or may not be a deterrent to taking the vaccine. The testimonials of the vaccine trial candidates, like we heard from Representative Martin, help create realistic expectations of the temporary discomfort when the body starts actually building immunity after the injections. And we understand how people respect that we have to give first priority to our healthcare workers who are at greatest risk of exposure to the virus, and for our kupuna who live in settings which may actually increase the risk of spread. Because if our kupuna contract this disease, the consequence for them can be extremely serious, with a high probability resulting in death. So with this understanding, we launched a large survey to sample the overall community. The survey is actually still in the field with the expectation of closing it this Sunday evening. As of Wednesday this week, we have collected close to 3,000 responses from residents from Hilo to Hanalei, clear across the state. I requested a top-line report just to get an idea where we stand. Overall, 45% of residents said they will take the vaccine if it's available to them. There's another large group that said they would wait and take it later. So it's not an absolute no, they just wanted to be not the first group. I don't have the percentage on that yet, but we'll have that when we complete the study. We found out those who with priority are more ready to embrace the vaccine. 66% of our healthcare workers and first responders expressed they would take the vaccine if it was available today. And for our kupuna community, 75% of residents 55 years and older said they would take the vaccine. The percentage increases with age. It jumps to 79% for those who are 75 years or older. Now, just understand that this study is still ongoing, and I just did a quick data poll. In addition to that, we found that 76% of our residents support the prioritization of allowing our healthcare workers and kupuna to take the vaccine first. Perhaps they understand the risk this virus presents to them, but perhaps this also allows them to take the vaccine at a later time. Next slide, please. We will learn more when we complete our study and finish our analysis, but we can feel confident with some of the messaging that we would like to start using. For example, by focusing on caring for our kupuna. And the best way to do this is to make them a priority for vaccine protection. They are the ones who are struggling the most with the isolation from loved ones, including not seeing their grandkids growing up, and having very little contact with them. Next slide. And making our medical professionals get the protection they need beyond wearing PPEs. They tell us they're willing to take the vaccine now so that they can have that added layer of protection and have peace of mind when they go home to their families. They have also told us they want to have the added confidence as to continue to help their patients and to set an example for those patients to take our vaccines too. Truly, these are our everyday heroes. Next slide. In our island lifestyle, connecting with others is incredibly powerful for our mental health and sense of well-being. To heal from turmoil from this pandemic has caused us. I mean, that's what connection is. If enough people take the vaccine, it would create better opportunities to reconnect as we did before. And next slide, please. And of course, not to mention what it means for our businesses, to keep the employees safe and their customers too. So in conclusion, we still have a very heavy lift ahead of us, but I don't feel the challenges are insurmountable if we all lift it together. Mahalo for this opportunity.
Thank you very much, Alan, for your perspective. I really appreciate the visuals. Up next is the Medical Advisory Working Group. So we're happy to have Dr. Curtis Toma of the Hawai'i Emergency Management Agency. For the remaining speakers, we are running a little bit behind schedule, so if you can please be as brief as you can. Thank you.
Hello, this is Curtis Toma. So by background, I'm a primary care doc, most of my career at underserved sites, the past several years at Hawaii Medicaid as the medical director, and the past several months, part of my FTE is with Haima COVID response. For the COVID vaccine, I'm on two work groups, the prioritization group and the medical advisory group. So I'm going to talk a little bit about the medical advisory group, and I'm going to jump into a project that we're working on. So the medical advisory group is headed by Dr. Steve Hankins and Dr. Sandra Chang, and both really experts in the COVID vaccine. Some of the work that they've done is really behind the scenes. For example, there were 2 webinars with the physician groups this week. A lot of people helped with preparing for that, but I think some of the heavy lift was Steve Hankins and Sandra Chang really kind of mining through the data and kind of synthesizing it and presenting it back. The other thing the medical advisory can do is be a resource to other groups, like the communications group if needed, and Lee's group with prioritization, as there's more details into how you kind of tier the patients. But that's just a brief overview on that group. So interesting project that just started coming out is one of the things we looked at is who's at high risk that's not in the highest tier, who could benefit that's not at that point. And what we did is we looked at the CDC advisory that came out on December 1st. And if you look at the highest risk groups, it has a long-term care facility, skilled nursing facility, assisted living facility, and other residential care. So what is other residential care, and who could fit into that bucket? Who could be moved up that could benefit? And we came up with 3 groups. One is a developmentally disabled group. The other is elder foster care homes in the community. And the third is adult residential care homes. Now, why is it important to try to move patients up? And does timing make a difference? Timing makes a difference. So if you think of these really fragile groups, and you think of like the VA, and the VA, when we had an outbreak, they had several deaths a week for quite a few weeks. So timing can make a difference. And keep in mind, the bucket after long-term care facility is essential workers, and that bucket is huge, like hundreds of thousands. So where you're at in the queue makes a big difference. We do think these are the 3 highest priority groups, well-defined. We have rosters. They've already been met some kind of bar to get into these programs. So we checked with Ron Balahadia, the people in charge, and the answer was, yeah, that's a deserving group, but can you figure out the logistics? So now there's a scramble to kind of figure out the logistics. Not a lot of time, but we made a big push. Last week we were, yes, they should be in. Can we do it? We're not sure. I think this week we're at, yes, they should be in, and can we do it? Yes, we can do it. So we have to do it because we have to do it for the patients. Now, some of the logistics is going to be a nightmare, honestly, because when you look at healthcare personnel, there's the hospitals that kind of surround them. When you look at long-term care facility, you have HAH kind of surrounding that. And when you look at this other residential care, it's really like a grassroots effort to kind of move these groups up. So still a lot of work to be done. We think it can be done. And we're really grateful for the kind of Ron and his group to even consider these groups moving up. I do think in other states, they're probably not going to move up these groups because there's so much time constraints with the logistics. They're just going to move with the skilled nursing facilities. We would obviously come after the skilled nursing facilities, but we're going to give it a good crack. So that's it on my side. We can talk more in the details maybe in the Q&A.
Okay, great. Thank you very much, Dr. Toma. The next presentation will be the Vaccine Provider Outreach and Enrollment Working Group, which is again Dr. Buenconsejo Lam.
Hello, everyone. Thank you. So yes, while we're getting the slides up, the main focus of this group is on the vaccine provider enrollment. And so these are the facilities that will actually be giving the vaccine. So unlike the flu vaccine or the chickenpox, vaccine or the measles and mumps that we give to, school-age children, at least for these first two phases, the vaccines, have very specific storage and handling and data and reporting requirements. So you can go to the next slide, please. And because the Pfizer vaccine, which is the one that we're anticipating first, has very specific ultra cold freezer requirements, the logistics are particularly challenging. And again, you'll hear more from that. And so you can go to the next one. So again, this slide just shows everybody who's involved. But we're really focusing, this work group is really focusing on those entities with the capacity to do large scale vaccination in phase 1 and phase 2. So again, these are the higher priority populations. So of course our larger hospitals are included in this. And our pharmacies, in particular, the 2 pharmacies that have the federal contract to help vaccinate those in the long-term care and other facilities, like Dr. Toma just mentioned. But this work group is also important to start the planning and recruiting and getting the information out to the physician offices, because we do anticipate that with other vaccines, not the Pfizer one, but with other vaccines, and once there's a much more widespread supply and we start to vaccinate the broader public, then the physician offices actually will be critically important. And so that's why there's a lot of the organizations from the different subspecialties, medicine, pediatrics, family medicine, OBGYN, anybody who actually gives vaccines in their office routinely. But we also have emergency medicine, and we've got many physician provider organizations and others. And again, the retail pharmacies. And from UH, we also have our School of Pharmacy and many others on this group. But just suffice to say, there's a lot of requirements with this vaccine because it is under Operation Warp Speed. And we all want to make sure that the vaccine is administered properly and accounted for and nothing goes to waste, et cetera. And so that's really what we've been focusing on. And then again, we're all interrelated with the working groups. And so what we learn in here, we share with the other working groups. Thank you.
Thank you very much, Dr. Buenconsejo Lam, for doing double duty. The last vaccination working group is the Program Training and Exercise Working Group. And here presenting will be Angela Henderson, who's the lead planner in the Office of Public Health Preparedness with the Department of Health, and Lieutenant Colonel John Ishikawa, a Senior National Guard Advisor to the Department of Health. Thank you both for joining us.
Aloha and good morning, everyone. Thank you for this opportunity to brief you today on the vaccination training and exercise efforts. I know there's 2 names on the introduction slide, but in the interest of time, I will be briefing for Lieutenant Colonel Ishikawa, but we will both be available for questions and answers afterward. My name is Angela Henderson. I'm the Senior Planner for the Office of Public Health Preparedness with the Department of Health. I am excited to have the opportunity to speak to you briefly about what the Department of Health, our state, county, and healthcare partners are doing to ensure the safe vaccine administration to the medical facilities and first responders through the county closed points of dispensing, also known as pods. planning efforts. I would like to start off by saying that the Department of Health has emergency preparedness plans and procedures in place, and every year we conduct exercises and train on these plans. If you can go to the next slide. In January this year, we held a live exercise with all the counties in which we practiced the security and transportation of medical countermeasures. And even though this was a live exercise, it was not for COVID-19 vaccine. The exercise practiced on operational, logistical, and administrative processes that we're still dealing with for the COVID-19 vaccine operations currently. During this response, the Department of Health, Hawaii Emergency Management Agency, National Guard, and Lieutenant Governor Josh Green have participated in 2 FEMA exercises within the last couple of months. One was with the regional states and the other one was with our Pacific Island neighbors. The focus of FEMA exercises was to share current vaccine planning initiatives on topics such as cold chain management, community outreach, and unique cultural and ethnic challenges. Participants shared knowledge with each other, and we are using that knowledge to update our processes and procedures for vaccine distribution. We are updating and building upon plans already in place, as well as the COVID-19 vaccine information provided by Operation Warp Speed, the CDC, and other credible sources. As stated earlier, we're in constant communication and working with medical facilities throughout the state to ensure safe delivery, handling, and storage of the COVID-19 vaccine. We are also in regular communication with our county emergency management agencies to discuss, review, and update closed pod plans and procedures that will be effective for each island. Next week, we will be conducting exercises on the existing pod plans and procedures with each county to help identify and address gaps and shortfalls before the vaccine arrives. Thankfully, though, many of our healthcare and county partners already have experience with the Stop Flu at School program. So next week's training will focus on critical aspects of handling administration of the Pfizer and Moderna vaccine. So as you see from our slide that's posted right now, we have some future exercises past the county closed pods. These exercises will focus on phase 2 and 3 of the operations and could possibly include larger pods. We still have a lot of work ahead of us, but we'll be in daily communications with all levels of personnel and agencies. Thank you everyone for your time, and Lieutenant Colonel Ishikawa and I will remain for follow-up questions. Thank you.
Great, thank you very much, Angela. So next we're gonna move to some perspectives from the folks at the receiving end of the vaccine distribution and all of this working group. All of the planning and everything eventually leads to the end users. So first up, I'd like to welcome Wes Lowe, who is the Chief Executive Officer of Halemaku on Maui. Thank you, Wes, for being with us.
Thank you, Chair Keokalole and Chair Ichiyama. Hi, I'm Wesley Lowe, the Chief Executive Officer of Ohana Pacific Management Company and Halemaku Health Services on Maui. Just real quickly, our Ohana Pacific family includes long-term care nursing facilities on Maui, Kauai, Hawaii Island, and Oahu. We have 5 on the neighbor islands, 3 on Oahu. We also operate 2 care homes, 2 home health agencies, and 3 adult day health agencies across the state. I'm also here to represent HAH. I am the chair of the Long-Term Care Committee, which represents over 45 nursing homes across the state. So firstly, I want to thank the state and the governor for prioritizing healthcare workers in this first allotment of vaccinations that we delivered in Hawaii. Next slide, please. First of all, happy holidays. I wanted to start with this photo because I feel it really illustrates the reason why we are encouraging our residents, staff, and community to get vaccinated for COVID-19. As you can see in the picture, Santa visited all of our residents at Halemaku this week and gave each one of them a gift. It was far short of being able to spend it with their families. It's been a very challenging year for the long-term care industry, particularly the nursing facilities, where nearly all of us stopped visitations in April. And we had to resort to some odd visitation strategies, drive-bys. Now we are actually allowing them to get within 10 feet of them, but it is basically when we have the visitations, not only the residents and the families are crying, but the staff are crying because it's a very hard thing to see them separated from their families. So we need to return to normalcy. So just a couple quick stats. Long-term care facilities account for about 6 or 7% of the total cases nationwide, but they account for 40% of all COVID-19 related deaths. We are super encouraged that this vaccine will protect our most vulnerable population and begin the road to normalcy again, where our residents will be able to see their families regularly. For those of you who don't know, loneliness is one of the biggest plagues of aging and in nursing homes. And with this vaccine, we'll be one step closer reconnecting our residents with their families. Next slide, please. Let's see, make sure. So the vaccine implementation in long-term care, the state has opted into the federal pharmacy partnership program for long-term care. So the long-term care industry is working with the Healthcare Association of Hawaii and the State of Hawaii Department of Health to prepare vaccine distribution through a closed pod or points of dispensing on each island. I think that was stated by some of the earlier speakers. All Hawaii nursing facilities have signed up for this vaccination through this pharmacy partnership program, which is being administered by Walgreens and CVS to manage the vaccination of residents and staff. Walgreens and CVS in this partnership are responsible for cold chain management, ordering, administering, and reporting under this program. As you probably have heard through the news, for the long-term care facilities, Mrna has been chosen by the state of Hawaii for all long-term care facilities. We are hopeful and anticipating delivery of the vaccines somewhere around Christmas. Let's see, and the facilities have started preparing education for all staff, residents, and resident families. We are working on informed consents and waiting for the emergency use authorization fact sheet so we can start providing that to residents and staff. The pharmacy program, next slide, I'm sorry. Next slide. The pharmacy program is planning to provide vaccinations over 3 different clinic dates. And this will allow us to stagger vaccinations for residents and staff and to manage through some of the potential side effects of this, whether it's staffing issues or managing through resident spikes in fevers or some side effects related to that. Through HTH, we are ensuring collaboration and communications with the Department of Health and all the major acute hospitals. And we are definitely making sure that we are starting messaging now to make sure that we can reach that tipping point on the vaccinations. We need to get about 70 to 80% on the tipping point so that we can actually return to normalcy. Just one other side note is the assisted living and other large congregate settings for older adults are expected to receive vaccinations approximately 1 month after completion of the nursing facilities. So basically, I'll be happy to answer any questions as we get through this presentation. Thank you very much.
Great. Wes, thank you very much for that presentation. So our final guest speaker for today's presentation is Josie Howard of We Are Oceania, an organization that was really critical in providing outreach and collaboration in the Pacific Islander community that really helps, really was successful at turning around the surge that happened in Hawaii, on Oahu in particular, at the end of the summer and in the fall. Josie, thank you very much for being with us.
Wait. Hello, can you hear me? Okay, good morning and thank you so much, Senator Kehokalole. Next slide. Are we sharing the slide? Sorry. My name is Josie Howard and I'm the program director of We Are Oceania. Thank you so much for inviting me to speak. I will be speaking from the lens as a social worker and a service provider and a Jugis woman. When we talk about the vaccine, and I can also include that I sit on several COVID task force within the Native Hawaiian Pacific Island community, nationally and state, also the Micronesian community. And so when we talk about the vaccine with the population, we have to put on our cultural lenses. And so for me, I wanted to, when I was asked to speak, I know right away that I'm not the person to speak on behalf of the community because of our cultural values. And one that I want to share with us is our core value of family. Relationship is the key for our social system within our, especially speaking from a Chugi's perspective. So therefore, COVID vaccine is a family affair. So it should be family and lineage and not the community. So for service providers like me and also members of this COVID task force, I think it's really important for us to be supported in our work by giving us time to do outreach. So in the effort of educating the community, we will need to provide the information within a linguistically and culturally appropriate way, so that we can be able to communicate respectfully to the community. Our goal is the same. We want to save lives. We want to stop the spread of COVID. I use this particular picture because on that shirt, it says, "Together we can stop the spread of COVID." Next slide, please. So therefore, my recommendation to you all, and I thank you all so much for all your hard work, that together, if we can build, a messaging for our communication with facts about the vaccine, and if we can allow more time for the community, the families, to be able to process this information and be able to make a informed decision. And I think together we can be successful in whatever goal outcome that we want to reach. And I thank you very much. I will answer any questions if there's any. Thank you.
Okay, great. Thank you very much, Josie. And thank you to all the presenters today. The presentation does not really highlight the amount of frantic and significant work that's gone into organizing this huge plan in which dozens of people have participated, and then even just putting together this presentation today. So thank you all, especially the presenters on the back end, for getting us back on schedule. So Representative Ichiyama, with your indulgence, I think it might be appropriate at this time for us to just move into questions. Would you like to do that? Okay, so as I mentioned before, members, please keep your microphones muted until we call on you. And if you have a question, type it into the chat box so that we can queue you up in order, and we can make sure there's an even split between the House and the Senate, because we're working together for this. So we're gonna try and keep it amicable. So the first question asked earlier was by Representative Wildberger. And I think it was in relation to the earlier presentations from Dr. Collis or Dr. Ashton. Representative, why don't you unmute yourself and you can go ahead and ask. Thank you.
Aloha, everyone. Thank you very much, chairs, for convening this important info briefing. I am curious to know if this Pfizer and Moderna vaccines are the first mRNA vaccines that will be widely distributed, or if there are other examples of mRNA vaccines that the general public would already be familiar with. Thank you.
So this is Melinda Ashton. I would say these are the first examples that are being distributed in public. There are some experimental vaccines with mRNA platform, but not widely distributed that people would be familiar with.
Okay, great. Second question was actually from Senator San Buenaventura, and all she asked was if the presentations will be made public, and they will be provided to the members and made public after the hearing. Are there any other Senate questions? Because that one shouldn't really count. Senator San Buenaventura, did you have another?
No, thank you very much. But that was basically, and I thank all the presenters for covering everything. Thank you.
Okay, members, questions?
We had a question from Rep. Mizuno.
Thank you, Chair. Appreciate it. Wanted to thank the presenters too. Excellent job. Real quick question. I know that we're going to have some dedicated vaccination sites. I think that's a great idea. Question is, will you also have a mobile COVID vaccine team? Again, some of our long-term care patients may be bedridden. It may be difficult to get them transportation. So first question, mobile COVID vaccine teams, is that going to be a reality?
This is Dr. Char. I think I can probably take that question. So right now we're really focused on the 1A priority groups. Just to kind of clarify, when you say mobile teams, we understand that some people may not be able to get to a site where a vaccine is being offered. So we are working absolutely on having provisions to go to the site where they are at.
Thank you, Director Char. Appreciate it. One real quick last question. Adult daycare clients, they would be considered in the Kapuna group. I'm just wondering if they're also going to be considered as part of the long-term care facilities that will be the first tier group targeted for the vaccine.
So yes, we're focused on people who reside in long-term care facilities, and many of those that go to daycare live in residential settings. But we definitely have our eye on them, and that is a priority group.
Thank you, Chair. And thank you, Director, and thank you both chairs. Appreciate it.
Okay. Members from the Senate, questions?
I am.
Okay, Senator Moriwaki.
Yes, I want to thank you and the committee for all this valuable information. I do want to thank, was it Wes, the committee looking at the adult care homes and the foster care homes, because they are pretty much in the community and not with the kind of the antiseptic kind of protections of the hospital or long-term care facilities. And I just wondered how the distribution there would go about, what the POD on that might be in the first phase 1A.
Senator, I can only answer on the larger care homes. The 2 care homes that we operate are 20 beds plus. So they will be my understanding. My understanding is that will be approximately 1 month after the nursing facilities are done. I think I would have to defer to the state regarding what we call the type 1 arch and other congregate livings, which are the smaller ones, which will be definitely a challenge. So I think I will, we were just covering sort of the larger congregate living settings.
Thank you.
Yeah, we definitely, we're definitely aware of that population, and we're trying to work, having conversations with the Healthcare Association, with Hilton Rayfield, to see if the hospitals will serve as hubs to help vaccinate those other individuals, as well as with some of the private pharmacy groups.
I believe there are about 1,200 of those kinds of care homes. So I think it'd be really well worth our while to look into how it can be done effectively and efficiently. So thank you very much. Thank you.
Thank you. Just a reminder to members and to our experts on the panel, when we recognize you, can you please put your screen on so that the folks on YouTube know who's talking? And with that, Representative Ward, I believe you're next.
Thank you, chairs, and thank you, leadership, for having a pandemic committee. I have 2 questions that I submitted to Chair Ichiyama. The first one is kind of a generic to anybody who can answer it on the panel or otherwise who's in the call, and that is, it appears that we're relying on the vaccine as a silver bullet, and the testing of which, to my way of thinking, should go parallel, brings to question, which I know the senators have seen and heard. Patrick Sullivan and spit in a cup, 10-minute results, $20, kind of self-administered like a pregnancy test. Are we going to act on that before the CARES money goes away? This may be a Bichar question, but because if we're only going to rely on the vaccine, some people are not going to take it, but some people should still be tested. So I think we have to get testing, and this is the Oceania just down the street from us here in the Capitol with Dr. Patrick Sullivan. So is there anyone on the panel or within this call that could answer that to a degree? And I know, Roz, you heard and asked very pertinent questions to Patrick. Are we just letting them kind of hang on the side, or are we going to kind of put them front and center? Or are we relying all of this solution on the vaccine? That's question one.
Thank you, Representative Ward. As a member of the Senate Special Committee on COVID-19, I can report that we did receive an update on the Oceania testing trial that's being conducted with Queens, and they are preparing an application for approval of that test to the FDA, but have thus far not submitted it. Although from what we've heard and what they've reported, that pilot has been going very well with Queens. Dr. Char, would you like to, do you have anything else to share on that?
Yeah, so to Rep. Ward's point, you're absolutely correct, sir. This is not a silver bullet. This is another step in protecting our community, and contact tracing and isolation and testing will continue to be very important in the fight against this pandemic. The vaccine is another tool to help us gain that safety amongst our community.
Okay,
excellent.
Great. Next question will be from Senator Baker, followed by Representative Eli. Senator,
I get a second question later then, Senator, correct?
We will put you back in line, yes.
Okay, thank you.
Thanks, Chair. Excellent briefing. I'm wondering if we are making provisions to translate some information either into Ilocano or to some of the other languages that are spoken in our community, so that people have some instructions in their own language, and we may not have to send as many interpreters out with people to the areas that they might be getting vaccinated. Thanks.
Perhaps Alan Tang can address some of that.
Hello, Senator. Thank you for the question. Yes, we're definitely looking to translations, and we're going beyond that by actually working with outreach groups to be sure that those communities are not forgotten. They have, I think one of the benefits of doing that is that we actually learn from our outreach that some of people were thinking that the vaccine is a cure. And we need to kind of, change that misinformation that a vaccine is a prevention, not a cure. You take it not when you get when you get infected, you take it so you don't get infected. So, we've been doing a lot of listen and learning in the community, and that's also very beneficial to how we model our messaging. But definitely we'll be translating and making sure that those who are not English speaking, will be able to consume the information.
Thank you, because I would imagine that a number of those individuals are going to be, that may not be English speaking, might be in categories that need to get the vaccine first. Thanks. Thanks, Chair.
Thank you. Representative Eli.
Aloha. Mahalo to the presenters. I had a question about the cold storage. If someone could go over how that would be done for each of the neighbor islands. I think there's a lot of interest in how that's going to be taken care of.
John or Angela, do you want to address that, please?
Sure, Dr. Char. So we are tracking ultra cold storage in limited capacity on Kauai. Maui also has ultra cold storage at Maui College. They're also going to be installing additional ultra cold storage at Maui Memorial as well too. Big Island has a little bit bigger of a challenge because they don't have necessarily ultra cold storage, but each of the thermal insulated containers are going to come with an initial shipment of dry ice. And then we are working right now in the department's operations center to supply dry ice to each of the neighbor islands that have limited means of ultra cold storage. And that dry ice, the second replenishment needs to happen 5 days after the original receipt. And then if they don't use that vaccine within another 5 more days, then we would send them another shipment of dry ice.
Oh, okay, thank you. What is the capacity for each island as far as storage?
So it's fairly limited on Kauai. I believe they can only store up to maybe 4,000 vaccines of ultra cold storage. And then Maui is unsure right now, Maui College, but they look to have pretty good storage capacity at Maui College, and unsure right now of how much ultra cold storage will be at Maui Memorial eventually.
So how often will they be replenished? Do you folks know that yet?
Every 5 days, we need to replenish the dry ice in the thermal insulated containers, and that is just for the Pfizer shipment.
Okay. Okay. Thank you.
Sure, no problem. Thank you.
Through this dialogue, it's been very interesting because with all the attention on the cold storage, members of the community have come out and informed us of their capacities as well. For instance, on the Windward side, Windward Community College actually has an ultra cold storage refrigerator and volunteered capacity for that, at a point in which it might be necessary for distribution on Oahu, particularly on the Windward side. So thank you for the question, Representative Eli. Senators, are there any questions? Okay, before Representative Ward asks his question, I have a clarifying question for Dr. Char and the members of the working group. We've covered a lot of ground as it relates to long-term care facilities and nursing homes. When it comes to the jails, which on Oahu was the location of a major cluster, can you provide some clarity as to the prioritization of jail staff and inmates?
All right, this is Dr. Char. I'm not sure if anyone on the team wants to jump on that one. So we look at congregate living. And so a jail is a good example of that, where you have a lot of people living together and it's really hard to isolate or separate people out. So they're definitely a priority. Additionally, the employees there are considered essential workers. So they are definitely both the inmates as well as the staff are all in the high priority groups. It's very difficult to separate people and isolate them if they get sick. So that's why they're in the high priority groups. Similar to long-term care facilities, if somebody were to get an infection, it's really hard to separate them and keep everybody else safe.
Okay, thank you. Before Representative Ward, Representative Ichiyama.
Thank you very much, Chair. I have a question about, as this process is being unrolled, where should the public go to find out more information? If they want to know, where am I on the priority list? How many vaccines have arrived? Where should I go to get my shot? Where is that information going to be available?
Alan might be able to address that. We do have a website.
Yes, thank you for the question. Yes, the website, HawaiiCovid19.com/vaccine is a fairly new page. We have brought it up about 2 weeks ago. Has all of the latest information, and we'll be continuing to update on information as we find out more about the vaccines rollout. So I would direct people to our website.
And just to follow up on that, Alan, if they have questions, where should they call?
We will be setting up 2 call centers. One will be for the provider community and the other for the general public. Those details are being worked out right now, and we should be able to announce those contact numbers fairly soon.
Great. Thank you, Alan.
Thank you, Alan. Thank you, Representative. Representative Ward.
Thank you, Senator. As a footnote to your comment after my question, I talked to Patrick a couple of days ago, and he said it should be the middle of December when he gets his emergency authorization approval. And so I'm hoping that soon, but the catch-22 is procurement takes a long time. You got to write the documents out. You've got to do that. And by the time that maybe that approval comes, if it's later than the middle of December, the bell rings and then all the money's gone in the end of the month. So my sense was that, if we're really serious, we should start processing the papers, making it contingent upon the FDA approval and the emergency authorization. Okay, that's just a footnote to that. My second question is, and it comes from constituents who want a little bit more operational or actionable data. particularly in the contact tracing, we get a lot of generic things about, well, it's the Micronesian community, and it's, I mean, and then you get a little dark place on the map, which covers maybe 100,000, 50,000 people. Is there anything that we could do to go from this macro coverage to something a little bit more actionable? Like, where are these cases coming? Are they the guys in the bars? Are they coming out of the schools? Where was the contract? Was it outside in the open, or was it inside that they contracted with this person? Was it male or was it female? And I know we're doing age, but it's like all of the stuff that we're giving out, we can't actionably do anything about it. Is there any way we can get from this macro to more granular data so people can say, hey, you know, this is a place or a thing that you should avoid? Or is the privacy so strict, of which the governor hasn't waived, that we just throw out generics and we got this boogeyman called COVID-19 kind of creeping around, but we've got data of which we're not opening it up and sharing it with people to be mindful of.
Okay, Representative Ward.
See what I'm trying to get at?
Yeah, thank you for your question. I really do agree with the premise. We have 4 minutes left, and this presentation was intended to be focused on vaccinations. So I'm going to ask that Dr. Char reply to that question in writing. And with the chair's indulgence, I'm going to ask that reply be sent to the members of the committee. And I think you know, a week is more than sufficient time to provide some sort of response. We have Senator San Buenaventura, followed by Representative Cullen, followed by Senator Baker.
Okay, so thank you, and I apologize if this was covered, but this was something that I heard in NPR a couple of days ago. I want to know how long after the vaccine is removed from the cold storage is it viable, so that, is there a plan to not waste?
John or Angela, you want to take that?
Aloha, Senator. Thank you, Dr. Char. So as I understand your question, Senator, is there a plan to not waste vaccine once we remove it from ultra cold storage?
Yes. Yes.
Yes, ma'am. So that's part of what the Operations Center will continue to track. And then if we receive word that there might be extras vaccine in one location, we'll take that back to the allocation working group so that they can reallocate and form recommendation to give to the department's leadership in terms of reallocating some of the vaccine to go to another location. The ultra cold, if it is in ultra cold storage though, it can stay up to 6 months into ultra cold storage. Some of the vaccine that we're receiving here in Oahu, we're going to be keeping it in a centralized location such that we can ensure that there is no vaccine being wasted, and then we can quickly reallocate to other locations as needed.
So I'm sorry, my understanding is after you take it out of ultra cold storage, can you put it back in? Or my understanding is you have to use it up. So like if you are in a care facility and you have like 200 vaccines that you've taken out, but you only have like 150 people there who are willing, what happens to the other 50 vaccines? Do we just dump them, or what happens?
Fortunately, ma'am, we will only unfreeze what we need for that day. So it's very important to have arms lined up to be able to vaccinate, so that we don't unfreeze any vaccine that's not going to be used that day. Once we unfreeze that vaccine, the Pfizer vaccine, we have 5 hours to use it.
Okay, great. The last 2 questions we'll take are from Representative Cullen and then Senator Baker. Members, if you have further questions, you can email either of myself or Chair Ichiyama, and then we will make sure to follow up with the department or the members who can answer them and then distribute out to the members participating. Representative Cullen.
Thank you, Chair Kyoho Kalole and Ichiyama. My question is, as the vaccine plan starts to roll out, and this is on top of just a little further to Chair Ichiyama, is and besides passing along information to the community, as community leaders, how may we assist or partner in getting our state to an effective vaccine rate? So whoever can take that question, please.
This is Dr. Char. I don't know if Dr. Campbell wants to jump in on that at all, but Absolutely, we can use help. There are so many questions out there from the public. We're doing our best to answer it. And to the extent that you can help take those answers and share them and share the science and just keep people informed as to where we are in the timeline on the vaccine administration, that would be really, really helpful. We just need to get our message out there and amplify it. So we'll be putting as much information as we can for the public to keep everybody informed as to where we are on the website. And we will continue to message and try and do informational briefings.
Okay, so thank you. So as it continues to move forward, maybe we can continue to work with these two committees on getting our state to that very effective rate. Thank you.
Yeah, thank you. We could definitely use your help, communicating and messaging and bringing questions back to us if there are questions that you're hearing from your constituents, just to make sure that we're answering it and people are educated so they can make good decisions. So thank you for your help.
Great. Thank you, Representative Cullen. Good question. Senator Baker.
Thanks, Chair. This actually follows up on what Representative Cullen asked. Can you send us, you and Rep. Ichiyama, to the senators and all the representatives, the website that we should be sending people to, rather than having to do a Google search or trying to figure out what it is? I think if we can facilitate putting that information out to our constituents, then we help make sure that they go to the right place and they get the right information. Thanks so much.
Okay, great. Thank you very much for all of our presenters. Members, thank you very much as well for working with us on the Zoom thing. This was my first time. And so this is all good practice for us to move into remote proceedings in the legislature come January. So thank you very much for working with us on that and for your great questions and engagement. Before we close, for members of the media who are interested, there will be a media availability for all of the members, all of the presenters immediately thereafter. And I'd just like to close by saying that, throughout the life of this pandemic, since everything happened back in March of this year, there have been few opportunities, I think, for the state, and especially for a lot of the people in the Department of Health who have been working extremely hard to keep people alive, and members of our healthcare community as well, including the members who have participated today. And this really is one of the areas that I think the Department of Health and all of our dozens and dozens of partners deserve credit, because it is one of the areas where they have taken very proactive steps to put a plan together and work together to execute it. It's not perfect. There will be mistakes. There will be confusion going forward. But I think all of the folks who have participated up to this date really do deserve credit for their hard work. And I'm hopeful that that will lead to the best outcomes and facilitation of our vaccine plan possible in Hawaii. So thank you very much again. Another very sincere mahalo to Chair Ichiyama from the House for allowing us to conduct this briefing jointly. If any members of the public or anyone else have follow-up questions, feel free to email them directly to either of the chairs or the individual members, and we will do our best to receive responses from the participants. Thank you very much again. Happy holidays, everybody, and mahalo for joining us. Aloha.
Good job, guys. Good job.
Mahalo.
Good job.